Hi, Dr. John Wilhelm with Pro Chiropractic, certified chiropractic sports physician, and today we're noticing something about the way that Michelle squats. We were running through a functional analysis, actually shooting a different video when we noticed this, and thought this would make a great video that talks about function and how we can change function with some of the taping procedures that we do at Pro Chiropractic. So Michelle, I'm going to have you go ahead and run through 3 squats, and what I want you to notice is what happens with her heels. In an ideal squat situation, her heels will stay on the ground as she comes down to parallel with her femurs here. So go ahead and squat. And you'll notice that on the right side, she's able to keep her heel on the ground. And on the left side, she really has to balance, her knee has to change. When she, go ahead, one more, Michelle. And it raises up there. And so what we found in taking a history of her is that she had injured her fibula, broke it when she was in high school playing basketball. And so what we're going to do is put some pressure and rotate her tibia out and some compression around that fibula, and you're going to see what happens in the change of her squat. So we're going to go ahead and put some pressure here and go ahead, and she's able to keep her heel closer to the ground. Okay, much more functional. And try it up here. Okay, a definite improvement in there. So now we're going to do a functional taping called SPRT taping. It's a taping that uses a base layer. So Michelle, I'll have you turn facing this way. The base layer sticky just saves the skin from any irritation, because you're going to find the tape that we utilize is a rigid tape. And so we're going to recreate what I was doing with my hand with the base layer here. And we have 2 strips. One of these strips we're going to fold into what we call a tab. Now this is rigid tape. It has 0 stretch to it. It's called Leuco Tape. It's also commonly referred to as McConnell tape. And what we can do is anchor that down, leaving the tab. Okay? With the tab, we're able to make a mechanical pull. In fact, I can pull that really hard, and that tape will not come off this base layer. And with the next one, we're simply going to go over the other tape, catch our tab, and then functionally pull around like we were when we were making the difference for her. And you'll see that there's a lot of torque and tension. In fact, it creates a little puckering and dimpling of the skin there. Okay, Michelle, go ahead and turn back forward this way. Let's see if that makes a difference in your squat. Much better. Go ahead again. And her ability to stay down where she needs to be. So this is functional taping using Leuco tape with what we call an SPRT tab procedure. We're mechanically changing this. So if she needed to be functional in her sport or her work, and this required a lot of dynamic movements like a squat, this would be something that could help her for the big game or for training, and then we could do some rehabilitation actively with it to make a difference. If you have any questions, please submit those below. Be sure to like us on our Facebook page. Again, Dr. John with Pro Chiropractic. Thank you very much.